World Toothache Day, observed annually on February 9th, is a day dedicated to raising awareness about oral health, the causes of toothaches, their prevention, and the importance of oral hygiene. Of course, this Toothache Day is a pain that unites humanity. A small toothache can bring our world to a standstill. Many people underestimate the importance of oral health, seeing it as separate from general health. But do you know that the oral health affects overall health, linking conditions like heart disease and diabetes to poor dental hygiene? And globally, millions lack access to affordable and timely dental care. Today, we are going to highlight how lifestyle choices directly impact oral health. Welcome to the program Health 247. I am your host, Irene Okichu, and on World Toothache Day, we are turning our attention to oral health, a topic that impacts every one of us. Toothache might seem like a small issue, but they can signal larger health concern and have a larger significant effect on our daily lives. Joining us today to share insight, tips, and some fascinating facts about dental care, we have a guest in our midst. He is Dr. Theophilus Ago, who is a consultant of oral medicine. Stay tuned as we dive into the importance of oral hygiene and how to prevent those pesky toothaches from ruining our day. Stay tuned. Alright viewers, welcome back on this break, and I told you that we have a guest, and he is a consultant of oral medicine, and he's going to give us an overview of this day, that's World Toothache Day. Dr. Theophilus, you're welcome to the program Health 247.
Thank you for having me. I'm Dr. Ago Theophilus, a senior consultant in oral medicine at National Hospital Abuja, and currently I'm also the NDA chairman, that's Nigerian Dental Association FCT chapter chairman. So today we are commemorating the World Toothache Day, which is celebrated globally on February 9th. Why is World Toothache Day important? It is important for us to actually prioritize, prevent, and know how toothache affects the general well-being of individuals. Every February night globally, everybody comes together to share an awareness on oral health and the benefit it has on the general populace. So this afternoon I'll be telling us the significance of early prevention, early detection, and what to do whenever toothache arises. I also have some practical models here that I'll be using to demonstrate how to take care of the teeth, which include right brushing technique, the use of a dental floss, the use of a tongue cleaner. As we progress in the program, I will demonstrate that. Thank you viewers for staying tuned.
Interesting. So, doctor, I was about to just ask a question and you went in and I was like, oh, you've made my work easy. So I just want you to tell us why is this day important?
Okay, thank you so much. We are prioritizing oral health. We are prioritizing dental health. Okay, there's no health without oral health. So no matter how healthy we are, when a part of our body becomes diseased or affected, the whole body is affected.
Okay.
So the tooth or the mouth is not in isolation of the body. Okay. Somebody having toothache is sick, and somebody having toothache needs urgent attention because the person cannot actually function well. So the mouth is not in isolation of the body. They are all linked together. So we cannot isolate one from the other. So it's very important that we have that.
Interesting. So what are these common causes of toothache in the people? Like, what are the things, the common causes of toothache that people just overlook?
Okay, thank you very much. When we talk about toothache, let's start from what is toothache. Okay, we can have, that is pain originating from the tooth-bearing structures in the mouth. Okay. That's what we call toothache. Medically, we call it odontalgia. Odontalgia means pain arising from the tooth. Okay. So it is also important that it's only maybe a trained personnel like a dentist that can be able to differentiate tooth pain originating from the tooth or pain that are originating from the supporting structures or structures relating to the tooth.
Okay.
It's very important that we make this distinction. So the leading cause of toothache includes tooth decay, or what we call dental caries. Okay. We could also have periodontal conditions also causing toothache. We could also have trauma, maybe trauma, fracture to the teeth. We could also have periodontal abscess. We could also have we could also have some systemic effects, some systemic diseases also causing toothache can also be part of the problem itself. So those are the major causes: trauma, periodontal abscess, dental caries. Dental caries, I've talked about trauma, dental caries. We also have non-odontogenic pains that mimic toothache.
Okay.
Such pains includes the neuropathic pains such as trigeminal neuralgia, glossopharyngeal neuralgia, sometimes headache.
Wow, all these grammars are just so big, like I can't even
So
comprehend.
that's what I said, sometimes headaches. So patient will tell you, I have this pain and it is referred. Sometimes earache can also be referred to the tooth as well.
Really?
Yes.
Oh, wow.
So sometimes earache can also be referred to the tooth. So we have to be able to know exactly where the source of the tooth, or where exactly the origin of the pain is coming from. Is it from the tooth or not from the tooth?
Now, practically, what really causes this toothache?
Okay, like I said, there are different causes of toothache, but let me narrow down to dental caries.
Okay.
What people call tooth decay. All right? Dental caries, one, it affects teeth that have erupted. We call it post-eruptive eruptions of teeth.
Yeah.
So basically, what causes tooth decay? It's a combination of a lot of factors, which include one, bacteria.
Okay.
This bacteria resides in the oral cavity. Sugar, what we eat. Then this bacteria breaks down this sugar to form acid, and this acid eventually breaks down the hard structure of the tooth. The tooth has the tooth is covered by the enamel.
Okay.
After the enamel, we have the dentin, and then we have the pulp. So the enamel is what we see outside.
Outside.
It's one of the hardest known structures.
Maybe you can just demonstrate it here.
All right. Okay, this is like a model.
Yeah.
So this is the white part of the tooth. So it's the enamel.
Okay.
Let's assume that is the enamel. Just beneath the enamel, we have the dentin.
Okay.
Okay, the dentin actually have openings for blood vessels as well as nerve vessels.
Okay.
Then we have the pulp chamber, which is highly vascularized.
Okay.
So whenever there is dental caries, it starts from
the enamel.
From the enamel.
Okay.
From the enamel, it progresses to the dentin. From the dentin, it now progresses to the pulp. So when it gets to the pulp, we now call it pulpitis. That is when pain, because of the fact that the tooth is highly innervated, so the patient or the person starts feeling pain. Sharp pains. Okay, whenever the patient maybe takes hot or cold food, there's sensitivity. This can also cause toothache. And there's now pain. Then, if it progresses beyond that, it now gets to the root of the tooth. And if not treated, it can form what we call abscess. That is pus. Then form a dentoalveolar abscess. Then, depending on the virulence of the organism causing it, and then the person's immune system, this pus can now spread to form what we call cervicofacial infections. That means infections spreading to the facial spaces around the mandible if it's a lower tooth. Then if it's in the canine, if it's in the anterior tooth, it can spread to the canine space. Can even spread as far as to the brain, because it can be sinus thrombosis. So toothache may look small, but if not treated, its consequences are very grievous.
Interesting. So, but how can regular dental checkup help prevent toothaches and other oral health problems?
Okay, thank you very much. I'll start from when should one have a first dental checkup.
Okay.
So, according to the American Pediatric Dental Association, says that children should have their first dental checkup at age 1.
Okay.
So as early as age 1, a child should have a dental checkup.
I'm not sure people are aware of this.
So, that being said, then for adults, we expect that we have a routine dental checkup at least twice every year.
That's every 6 months?
Every 6 months.
Okay.
So we have a routine dental checkup. In this checkup, when you come, we check the teeth, we check the surrounding, we check the periodontium, that is the surrounding structure. We screen for if there are any signs of mucosal lesions or mucosal diseases. Are there any traces of oral cancer? We tell you, so that if there's caries like dental decay starting, we can be picked early and be treated, instead of allowing it to undergo the various sequelae that could, and stitching time saves 9. So prevent when the caries is just at the incipient level, it's easier to treat and is less cost effective than when it has progressed to involve the pulp and then the periodontal tissue, which may not necessitate more invasive treatment, like either a root canal treatment or extraction of that particular tooth.
Interesting. All right, so progressing now, what tips do we need to take to maintain a good oral hygiene so that we can prevent toothaches? Okay,
very good. Like, it's expected that we brush twice daily. All right, we'll say we brush last thing at night before going to bed. And then after breakfast.
After breakfast?
After breakfast.
Why not before breakfast?
Okay, it's expected that you brush last thing at night. So when you wake up in the morning, you just rinse your mouth, have your breakfast, then on your way out or before you start your day, just brush out the residue of what you have eaten for that for that day. So that's what we say, last thing at night, first thing in the morning, after breakfast. That is what we usually prescribe.
But don't you think if someone is just waking up in the morning, the person's breath must be a bit not good?
Okay, that now leads us to...
And you may even feel like there's a little bit of bacteria in your mouth.
Yes,
and you need
that now leads us to what we call halitosis, or what we call bad breath. So halitosis is what we call bad breath or fetal oris. This is one of the major reasons why people actually come to the dental clinic. Just second to after tooth decay. A lot of persons come to the clinic and tell you, oh, I have bad breath. So there's what we call physiological halitosis. Okay. And physiological halitosis could be caused by, maybe probably when you wake up in the morning, because of the fact that saliva has pooled in your mouth overnight. So there may be a form of odor coming out. So of course some of those will fall under physiological halitosis. That means by the time you rinse out, you are good.
Okay. So just with ordinary water?
Yes, or with ordinary water you are good. It's different from pathological halitosis. It's also different from delusional halitosis. Okay. So when we talk about pathological halitosis, that is halitosis that is caused by an underlying problem, which could either be in the mouth or coming from other parts of the body. So we can have halitosis originating from maybe a diseased tooth, maybe a tooth that is having caries. So bacteria, food is packing there, and then there is foul smell coming from that region. We could also have periodontal diseases also causing causing halitosis. We could also have poor oral hygiene when the tongue is coated, and other systemic. Then we not go to systemic causes. It could be one, sinusitis. That means it's coming from the nasal region. It could also be coming from the gastrointestinal tract. Maybe somebody's having esophageal reflux disease. It could also be as a result of ear, nose, and throat infection, chest infections. All those can also cause halitosis. Meanwhile, there are some that they just feel that they have halitosis. No matter what they tell you, they say, oh, whenever I talk, everybody feels that my breath is bad. And meanwhile, when you examine clinically, there is not. So we call those ones psychogenic or delusional halitosis. So each of these have ways in which they are being treated.
Well, you know, sometimes when you feel your breath is bad, most of the times you have to like kind of breathe out and perceive it. When you perceive it closely, or when your mouth is, your hands are covered, you definitely know your breath is.
There are ways that we would examine and check critically. One, we can do the organoleptic test. Then we can actually, because the culprit of bad breath is actually volatile sulfur compound. So there are machines such as the halimeter, such as the oral chroma. So this measures the amount of gases that is being produced. So if they get to a particular level, we can actually say that there is halitosis. These are the volatile sulfur compounds. So like hydrogen sulfide, mercaptan, and the like. So once we're able to do an assay, like I said, okay, can you do a gas chromatography for them? The halimeter can measure the amount of this substance. Oral chroma can also do the same. So we also have the, like what you were talking about, the Riesling test. So it's subjective. Yeah, those are subjective. So you may say, oh, I have bad breath, but somebody else will say, no, I don't have bad breath. So depending on the level of our perception.
Moving forward, we have a model right in front of us, and I want you to demonstrate, because so many people do not know how to brush. I give an example, like as this brush is looking so straight, there are some people's brush that when you give them today, you come next week, the brush should be like this.
Okay.
So, and funny enough, when they want to brush, you see them only brushing here. And it's always, they use force to brush. And the last thing they'll do, they'll bring out their tongue and be scrubbing it. Like, brushing is so hard that at the end of the day, you may even see blood stains in whatever they're doing. So I would just like you to demonstrate.
Okay.
Yeah.
Okay, before I demonstrate, I'll tell us, okay, about the toothbrush. All right, and the significance of a toothbrush. So we recommend that we use a soft texture toothbrush. We recommend that. So there are different texture. We have the soft, we have the medium. Soft, medium, okay. Then there are some that are hard. There are some that are, they call it the smoker's brush, which have a very hard texture.
Okay.
But one thing about the toothbrush is that sometimes, when do we know that, okay, we should change our toothbrush? A lot of persons don't even know. So once you notice that your toothbrush, the bristles are beginning to flare off, so you know that it is time to change it.
Okay.
Then when sometimes toothbrushes have like another color, either red or blue.
In between.
In between.
Yeah.
So once the red or blue or the color in between begins to fade away, it's telling you, okay, it is time to change me.
Oh, wow.
So we must know that. Then sometimes we'll tell our patient every 3 months, kindly change your toothbrush. But most of the time, we use toothbrush for 1 year, 2 years. So it's not part of our routine brush to change. But just let me use this opportunity to enlighten the public about that.
Okay.
So this is a toothbrush. Yeah. So we expect that you use a fluoride-containing toothpaste. Preferably any toothpaste that is endorsed by the Nigerian Dental Association. So get that, and then just apply a sizable quantity on the toothbrush. Okay. Then,
because some people are fond of making sure the toothpaste gets to the front to the end, very long.
No, we don't actually need that.
They will tell you it's not enough.
We don't actually need that. Like a sizable, like for children, depending on the age, you can just say smell it. Some can say use the size of a rice grain. Sometimes you can tell them to use the size of a pea. That is groundnut or beans.
Very little.
Very little. So we don't need so much, okay? Yeah. So let's assume this is a toothbrush, and then this is the jaw, okay? So we brush up, depending on there are different techniques of actually brushing. So angulate your brush. Okay. All right. With a sweeping motion.
Sweeping motion?
Yes, sweep up. So as you are sweeping, as you are brushing like this, the brush is actually massaging the gum, and then it's also bringing out all the particles.
Wow.
So like that. Then,
so not even like this?
No, not even like this. So we do that. Then you go inside, and then that is the lingual surface. So keep sweeping. Then the upper jaw and the lower jaw, you do that. Then another thing that we also need to do is that what lots of us are not doing is to floss our teeth. This is an example of a dental floss. Yeah. All right. So that comes in different form. Okay. Okay. So, all right. Okay. Let me just get another one. Okay. So this is a dental floss. So some come in a form like that, and then we just cut out of it. So some are already pre-threaded. Yeah. So at least we should floss once every day.
So while you're brushing, you use the dental floss too?
You can actually do that.
Okay.
Okay. So some persons also put dental flosses in their pocket whenever they finish eating. Instead of using toothpick, we recommend they use a dental floss. So this helps to clean the interdental area. Okay. So this helps to clean the interdental area. Interdental area. Okay. Then it also have like a pick behind, so use it to clean the tooth to make sure that there's no food particles in between the teeth. Okay.
So why do you recommend a dental floss instead of a toothpick?
All right. The reason is that repeated use of a toothpick can cause inflammation around the gum. Okay. That's especially the interdental area. Okay. And then causes what we call dental pockets or periodontal pockets. Okay. And this pocket leads to there is accumulation of food and could serve as a focal for periodontal disease and causes toothache on the long run.
So for instance now, if there is a hole in the molar, and so the premolar and the molars, right? Okay. and you're expected to brush, how do you now brush? Some people, because they know that there is a hole there, they'll carry the paste very well, put it in that place and be brushing. So I want you to correct this notion.
Okay. All right. When you have like a hole on the occlusal surface, that means the chewing surfaces of the teeth already has a hole. All right. So what's toothbrushing? When you brush the occlusal surface, what it's just simply going to do is to remove food particle, not that it's going to treat that cavity. The only definitive thing to do is to go see a dentist, let him assess where the dental caries has gotten to. If it's at the enamel or the dentin level, you can do a filling for it. If it has gotten to the pulp, we'll do a root canal therapy or root canal treatment. Or if it's so bad and then the tooth is grossly broken down, an extraction could be done. So we should know that. Another thing is that a lot of us don't know about that tongue hygiene is very, very important. So we also have what we call a tongue brush. And then a tongue cleaner. So this is an example of a tongue cleaner. So you roll it like this, and you use it to clean your tongue.
What happened to the brush?
The brush will not effectively clean the tongue.
Why? Because I feel like the brush is cleaning everything in my tongue.
No, so you should have like a tongue cleaner. There are some are like this. You just fold it and clean it out. Then there are some that have bristles as well. All right, so use it to clean the tongue and then you wash it over running water. So it keeps the tongue clean. The mouth is healthy, the mouth is fresher, and there's no bad breath.
What do you call this again?
This is a tongue cleaner.
Honestly, it is my first time. I'm a village girl. Sorry.
No.
I use my toothbrush to brush my tongue.
So that is why we are enlightening people that, there's actually a tongue cleaner. So probably when you visit your dentist the next time, ask, I need a tongue cleaner. They will be able to give you one.
So you can get it in the nearest supermarket
even in supermarkets and stores. You can also get them. When you walk in, buy some grocery, they'll just tell you, this is a dental pack. You may be able to see, this is a tongue cleaner. If you ask, there are different forms. So they are available in the, it's something I can walk up and buy anyway. Actually.
All right, let's just go for a short break and when we return. All right, viewers, it's been Dr. Theophilus Ago who is taking us through on how to maintain oral care. As you can see, I've learned something. He just told me now that there is a tongue cleaner. For those who do not know that there is a tongue cleaner, this is one. You just put it in your tongue, right?
Yes,
and roll it down. So we are going to go on a short break. All right, viewers, welcome back. On this break, we are talking on the World Toothache Day. So we are going to move straight to the kind of food that is expected of people to avoid that risks toothache. So doctor, over to you. What kind of food should you advise or encourage people to take so that they can avoid having tooth problems, or the food that should be taken?
Okay, as much as possible, we advise that you avoid food that have like fizzy drinks, all right, because they contain sugar, and the sugar can easily be broken down into acids. This acid now breaks down the tooth structures, so leading to dental caries. So we encourage that you take lots of vegetables, carrots. They are self-cleansing. So vegetables are fine. Then avoid fizzy drink, chocolates, because some of these chocolates eventually get stuck to the tooth. Chewing gums, not all chewing gums are bad. So there are some chewing gums that are not carcinogenic because they don't contain the sugar that causes dental caries. So maybe when next you want to buy a chewing gum, you look at it, they'll tell you, it does not contain sucrose. So those are healthy chewing gum to actually buy. So those are alternatives. Generally, our foods are good. We eat our most stable food. We eat eba, we eat gari. So the most important thing is that maintain a very good oral hygiene. Brush twice a day. Whenever you finish eating, rinse out your mouth. It's very, very important. Have your dental checked twice a day. So frizzy food, chewing gum, chocolates, ice cream. We won't say completely eliminate it, but you can actually reduce some of all those food.
Okay, you were saying something particularly on food. What came into my mind was cold water, like blocks. Some people are fond of taking blocks, most of the times when they take it, it affects their face. What do you have to say about that?
Okay, when you take something very, very cold, except you are prone to having sensitivity.
Okay.
That is when you feel that sensation, because the mouth has what we call nerve endings, or they have proprioceptive nerve ending that tend to adjust to temperature change. Sometimes because of this, I will call it surge of temperature change, you feel it. It's like maybe hot water pouring on you and you respond.
Yeah.
So you can also have such response in the oral cavity. So if you sip in a hot tea,
you also feel it.
Yes. So if you also take something extremely cold, you also feel it. So that is what happened in that particular case.
So that means person that takes ice block, you shouldn't encourage the intake of too much ice block. Just like whether it's hot, some people just feel like chewing ice block.
And they know that, except if it's a habit that we say, okay, the patient should actually try and stop. There are some indications that we tell patient, okay, chew on ice. Maybe a patient, for example, that is undergoing chemotherapy for head and neck region, we encourage them that as the session is going, chew on ice, because actually what it does is that it causes the vasoconstrictions of the blood in the oral cavity, thereby preventing the patient from having what we call oral ulcers or oral wounds in form of oral mucositis. So that is cryotherapy. So we can also do that. So we can also use ice as a form of treatment.
Oh, really?
Yes, in dentistry too.
Wow.
So it just depends on what exactly we are treating. But if it's for recreation, like biting on ice, chewing on ice, we won't actually encourage that.
You were talking about chewing gum. So what came into my mind when I went to visit the dentist, he told me that I should stop chewing gum, because I actually pulled off. I'm supposed to have 32 teeth too. I'm making a confession now, but I have 28 because I've pulled 2.
Okay.
It's a different story altogether though. But one of the things he told me, he noticed that I have holes in the, I think I'm remaining some of the teeth I have. He now told me I should stop chewing gum. And I was like, why? He said because the gum, the more I chew gum, the more it creates more holes. How is that true?
Okay.
Yeah.
Okay. Let's look at it from this way. Each of the tooth in the mouth are not in isolation.
Okay.
So they are all exposed to the same oral environment. They are all exposed to the same oral floras. But the anatomy of the tooth are different.
Okay.
So the anatomy of a tooth can also predisposes a tooth to having hole. Let me use that word, dental caries. Okay. So for tooth that have prominent pits and fissures, somebody will ask, what is pits?
Yeah.
What are fissures? Okay. We'll notice that our grinding tooth, these molars, all these groups inside, those are the pits and the fissures. So these are where food can, for some persons, these pits and fissures are so prominent that food can stick in there. And when food stick in there, they are broken down by the bacteria forming acids. But also notice that in the anterior teeth, they are smoother. So caries, yes, they can also be prone to caries, but not as susceptible as the molar teeth. Okay, so we should know that. So that being said, like I said, there are some sugarless gum.
Interesting, doctor. So lastly, what advice do you have to give to our viewers, especially knowing that every 9th of February is World Toothache Day?
Okay, for those that are watching us, if you've not had a dental checkup this year, it's an opportunity for you to visit a dentist.
Exactly.
Visit a dentist in any of the government facilities or any of the good private facilities near you. Have a proper dental checkup. It's very, very important, so that we can be able to pick up anything early. A stitch in time saves 9.
Saves 9. He just said it. A stitch in time saves 9. Dr. Theophilus, thank you very much for being our guest on the program Health 247.
My pleasure, ma'am.
All right, viewers, that's as much we can take on this very topic. World Toothache Day. I hope you have heard or learned something. I told you the only thing I learned here is this. It stays. So viewers, that's much you can take on this very episode, and we would love to see you on our next episode, same time and same station.